The threat from unconventional warfare agents, including poisonings due to chemical weapons and agents, has traditionally been considered as a military issue. However, several recent events have shown that the civilians may also be exposed to these agents. The intentional release of the chemical weapons might lead to thousands of casualties, thereby overwhelming local health and medical resources. Easily obtainable agents and are capable of causing mass casualties. It makes for an effective terrorism weapons. The use of chemical terrorism agents is effective because they are already available as industrial products, as it is observed in use of chlorine, phosgene, hydrogen cyanide, cyanogen chloride, and some of the terror agents substrates are widely available, for example in taboon and sarin nerve agents, so it is easier to synthesize chemical agents. Transportation and delivery of the chemicals are more available during a routine public life by a variety of routes. Unfortunately, receipts are available and accessible on the internet. Death can occur within minutes if not treated or leads to short and long-term sequelae. Death danger of chemical weapons depends on several factors, including the type and concentration of the agent, as well as the route, such as inhalation, ingestion, and skin contact, and duration of exposure. Exposure to highly toxic chemicals can cause rapid onset symptoms that can lead to death within minutes if not treated promptly with antidotes. Exposure to nerve agents leads essentially to a disruption of nerve impulse transmission. Blister agents like mustard gas are less acutely toxic, but their delayed effects mean that they can cause significant tissue damage and ultimately lead to death days after initial exposure due to secondary infections. Choking agents like chlorine gas have a moderate toxicity level but pose great risk when used in confined spaces where concentrations become higher, increasing the severity of symptoms including respiratory stress leading to suffocation. Blood agents like cyanide affects the normal consumption of oxygen by nearly every organ, leading to death or long-term sequelae such as Parkinsonian syndrome, neurocognitive and neuropsychiatric damage, and thyroid disorders. It is therefore essential that measures be taken towards prevention preparedness like training and protective gear usage, and response strategies like immediate decontamination measures and medical interventions.
Any toxic chemical compound used as a chemical weapon is a chemical weapon. Recent events have illustrated that anyone can be affected by a chemical attack or incident.
Timely antidotes and effective decontamination are key to successful medical countermeasures.